Hey there everyone, Debbie Reed here at Think Healthcare Solutions, Trust About Healthcare, and the Healthitude Academy. I want to welcome you here to our YouTube channel, and I'm over on Rumble as well. Trust is about healthcare and Think Healthcare Solutions. I wanted to talk about medical care in the United States and the trends and what's happening and where we're going moving forward. I really, I was impacted on numbers. I heard the 2,400% increase in healthcare expenses and the cost since 1960. And the fact that just in a year's time, we're looking at 22% growth. And there's a lot of factors for that over this last year or two that I won't go into, but even so, that's crazy, and you don't see that. That means not like that stuff just comes down, like, where cost goes up and then it doesn't. Healthcare doesn't work that way. It's going to continue to rise from the point that it's at. So why does it cost so much? Well, there's so many different factors, and all I can say without getting into the political arena is there's many reasons why. You have technology. Technology brings higher costs. We have a pharmaceutical, which can make or break depending on the type of medication, what's needed, and it's kind of like the newer versions cost tons and tons and forever before that price comes down. And it becomes very pricey. We have health insurance that drives the bus, and all these contracts and networks and in and out of networks and all of that kind of stuff. That's all factors in bigger and better hospital settings and remodeling and keeping up to date. It's a vicious circle on driving the costs up over time. And my next thought is there a hope for a better tomorrow for U.S. healthcare? I really think there is. We've gone through some transitions. We've gone through some growing pains. We have our problems. For being a wealthy country, we're really lacking in our delivery of healthcare. And whichever side of the fence you sit on as far as how you think it should be fixed, the only way at this point is to totally revamp and redo healthcare from the ground floor. All we're doing is putting layer upon layer upon layer of stuff, mandates and rules and all of that stuff, and it's not fixing the foundation, and the foundation is what is part of what's broken. So in order to actually fix healthcare, and our group has always said, we need a big group of great minds that can go in and totally restructure, re-innovate the delivery and the model of payment and reimbursement and all of that stuff, the rules and everything. A lot of stuff for a lot of different reasons have been built into healthcare, and primarily the CMS guidelines, that while understanding its intent, it's gotten way out of hand. And then the biggest thing for me is paying all of this money out to these healthcare insurance companies at the risk of them not paying anyway. It's become a really scary and unstable state of affairs. But because of, remember, we just talked about the pandemic and what it brought to the table, and I'm not talking about the sickness and everything. I'm talking about the technologies that are now being paid and being allowed through CMS and their rules, and insurance companies have followed suit, which has taken some pressure off of the delivery of healthcare, and has led the way for innovation by some really amazing doctors that want to get back into taking care of patients. The other problem with our healthcare industry is that the doctor's not practicing medicine anymore. And you may balk at that, but it's really true. And I'm not just talking about the pandemic and all of the stuff that falls around that. I'm saying in general, doctors are not being able, they've succumbed to big corporations and healthcare insurance companies that are dictating what they can and can't do. How, if you go and see a physician and he says you need an ultrasound, they may say, well, that has to be pre-authorized, and you have hoops to go through just to get an ultrasound. Now, do you need an ultrasound every other day? No. Do you need a CT scan? I mean, some of this by design has prevented excessive waste of resources and repeating procedures, unnecessary or necessary. But it's taken a lot of ability out of the provider, and I think that's really sad. I've been around long enough to see the transition. I totally understand. You know, back in the 70s and 80s, I mean, you had a baby, you were in the hospital forever. You know, you were you go in to have I remember back probably just prior to my nursing career, but they would go in, if you're going to go have a workup, you'd go into the hospital, be checked in, have a couple of days of testing. I mean, we don't do that anymore, and I'm kind of glad about that, but I'm just saying we have transitioned, everything has changed, but the bottom line is doctors have so many rules now to live by. In fact, a lot of times in the office, they can't get work done because they're so busy at the mercy of the insurance company, going through hoops to get studies done. Then it's gotten crazy where it's like, let's say you have a diagnosis that they're suspecting, and there's a couple of steps that they can take to get to the diagnosis. And one of them is, let's say it's, I can't think of a good example, but let's say it's you're leaning towards you wanting an MRI or a CT scan, the provider. But this particular diagnosis, the insurance company is saying you have to have an ultrasound first. Well, who's the insurance company? If this guy's really leaning towards this is more than likely this diagnosis, why do we have to go through the expense at the patient's mercy and the doctor's energy to make sure you have that done, and then depending on having the CT or the MRI done, when that's going to be the end result anyway, and that's what's needed? That's probably a bad example, and it may not make any sense to you, but it's just so many different things that don't make sense. One of my other big gripes is a patient, say 50 years old, is going for surgery probably maybe the first or second time in their life, and by protocol standards of the hospital or the doctor's preference, making sure maybe they had a conversation and they're suspicious of something and they want to have an EKG done, pre-op EKG. And your insurance denies it because of whatever, they've decided that they don't want to pay for it. Well, how is that fair for the anesthesiologist to take the responsibility to put you to sleep, to not know that you might have an underlying cardiac issue that the insurance isn't going to pay for? So that means that puts it on the patient to have to pay for that. And if they can't afford, I mean, do you see where I'm going with? There's so many layers of what happened to the doc that used to make house calls, and the doc that used to just care about the patient and be there and listen and hear. And another really bad example is my husband, a year or so ago, he went for his appointment and his yearly checkup, and he was having a problem with his leg. He mentioned it. The provider didn't really pay attention, didn't really care, didn't ask any questions, didn't take that minute to say, hey, what about this? Do you have trouble? Questions that you would typically ask regarding that type of, it was vascular in nature, but he didn't say anything. All he said was, because my husband says, my leg hurts walking up my driveway. Well, we have a very steep driveway, granted, but his response was simply, well, zigzag up the driveway instead of walking straight up. Well, a few days later, he's in with a vascular surgeon, potentially with the potential of losing his leg had he ignored it. So we're because that provider was focused on, you're here for one thing, and I can't go beyond that because my medical group dictates that I only treat this one thing and make you come back for another visit so we can get more money. That's what it comes down to. It's a sad state of affairs, but that's what it is. So there's so many different factors that getting sucked into the vortex of my insurance is going to take care of me is over. Gone are the days. That's not the case. There's a lot of share plans that aren't actually insurances, but they're cheaper alternatives, but they too have their issues. They profess to do bill negotiation and stuff, and I say there's a better way. So, and there's things that can save you even more money in the front end than on the back end. And if you have a share plan that has a network provider, there's one that uses the Aetna insurance network, which is fine. I'm not saying that's a problem, but it's a problem when you go beyond that doctor's office and you're dealing with facilities and the like. If they catch wind that you have a share plan, they may discount you, but they're not going to give you the best discount based on the fact they kind of treat you more like you have insurance, and which is really sad because a lot of times what you're going to have to spend out of pocket is out of your pocket, not your share plan. So there's so many different loopholes and so many different ways that you can save money even in this era of the high deductible plans, share plans, and the like. And then the other thing to consider is the direct primary care model, which is making groundbreaking strides over alternatives to the big box hospital groups and stuff that have been sucked up by hospital corporations. Again, I'm not against most corporations. There are better ones than others. But again, it reminds me of my managed care days when the doctors are being driven instead of allowed to practice medicine. And call me crazy, but I feel that very strongly. Or there wouldn't be so many of these primary docs stepping back out on their own and having these practices where they have their group of patients. It's like a community. They have their group of patients. They learn to understand them. Back into the model of the where's my picture? Oh, here we go. Back into the era of the caring doctor that waltzes in on his horse and buggy or in his whatever transportation, and comes in and sees the patient and takes care of them. That trend is coming back. And for years now, you've heard different isolated stories about, the doctors in New York that make house calls and all that stuff. Because of the telemedicine and the teledoc model becoming acceptable, it's opening that door and making things run smoother for these practices. And you do it. You can do a monthly, they have different models, the DCP or the DPC, where you can a monthly fee for you and your family. It doesn't matter how often, if you have several kids, and whether it's phone calls or text message, whatever, you have that relationship with that provider, and they get to know you. They actually spend time working with you, educating you on different things. You have also, there's the other model where you can pay by individual visits. So I'm really seeing a trend. There's also actually specialists starting to break into that model, which is exciting. We have a local orthopedic surgeon that's in a direct primary, or direct, and that trend is really exciting, and I'm really liking to see that take hold and grow. Give the big guys a little run for their money. I think hospitals serve their purpose. Doctors should be in their own element. I'm liking to see that get back to the norm. And that's one really great way of saving money, because they are taking the time, getting back into really evaluating, the medicines you actually need versus what they're paid or encouraged to prescribe, and educate you on your illness, and really grow that model. And it's really an exciting time, and I really, that's one of the reasons why we've opted to do what we do, because we feel like we can really support that primary care model and really help people to enjoy and welcome the wellness and health that they deserve. So yeah, I think we're on that path. We don't have to wait for the government to step in and fix it, because frankly, it's going to be a long time coming. And is it going to be in years of my lifetime? Who knows? I just know that none of them are willing to say it's really broken, and this is what we need to do to fix it. And frankly, that's the only way, is to erase everything and just kind of start over. And there's too much at stake. They all have, they're like stakeholders in sitting at the White, in DC. So I'm really encouraged and excited to see what we do in the industry and where we're going. And I'd like you to be there with us, and we can help guide you and direct you on a better path than the big loopholes of high cost bills and care that can be done in a more intimate and happier delivery system than being a number at the local big hospital setting. Hospitals are there. We can't control a lot of emergencies and stuff, but a lot of the basic day-to-day stuff, and you improving and taking ownership. That's my other thing on another conversation of consumers taking ownership and taking the reins and improving their health by making better choices. So on that note, enjoy, and I look forward to another discussion with you on a different fun topic. And please, would you visit our website and sign up for updates and more information as we get that out to you on how to do your healthcare better. Have a great day, and look forward to hearing from you.